And for more on the situation in Myanmar, we have Borrie Lagrange. He's Regional Director of Communication for Doctors Without Borders. Borrie, thank you so much for joining us. So the information, has always been difficult to get out of Myanmar. And now that some rescue teams have left, there seems to be this continuing blackout, if you like, of what's been happening. Can you kind of update us and help us visualize what the situation is like right now on the ground?
Yeah, thanks so much for the opportunity to talk about this. We have teams that have been present in Myanmar for several years. We've been active running medical projects in Myanmar since 1992 on a variety of issues, responding to displacement due to violence, but also infectious diseases like TB and HIV over the years. So we have a good sense of what the medical needs were in Myanmar prior to this earthquake in and around Mandalay. What we are hearing from our teams who've done assessments and who've started stepping up their response in terms of providing direct medical care, but also rehabilitative services at hospitals and medical facilities that have been affected, in some cases destroyed or disabled. The picture that's emerging really for us is one of massive destruction. That there will be significant needs that would persist over time, and that we need to be in it for the long haul. So we can see many rescue teams are returning back to the countries where they've come from, but the health needs will persist, and we can see that directly in very simple things like providing clean water. Many of the water infrastructure systems have been affected by this earthquake. So you have situations where in some of the outlying villages around Mandalay, 17 or so, where we've received reports from that 75% of their water infrastructure is down, is destroyed, and they will have to find ways to get clean water. So for us, it's really important to provide those basics, clean water trucking. We're providing hand washing stations at hospitals. We're providing water tanks for communities to be able to access clean water. And that's going to be incredibly important. As you mentioned, the weather is taking a pretty bad turn now with the rainy season about to start. So concerns around waterborne disease are significant, and it's important that we are able to provide consistent clean water supply, specifically to people who are living out in the open. As we can see, like many of the buildings are uninhabitable, so people are also afraid and were in the immediate period after the earthquake of aftershocks that their houses would collapse. We have seen also directly that a hospital with 300-bed capacity, most of the patients are currently staying outside. So it's really having to deal with the situation where the existing infrastructure is no longer fit, and having to replace that infrastructure.
Yeah, Borrie, let's talk about that, the psychological toll the earthquake and aftershocks are having on the affected communities. How is Doctors Without Borders adapting its mental health support services to reach the most vulnerable population? And what sort of challenges are you facing providing that psychological care under these conditions?
Yeah, it's crucial. I think we need to always be mindful of the fact that if something, the extent so large disaster occurs, psychological toll is immense on communities, which is why over the last couple of days we've also been training volunteers, medical students, and a range of other people in Mandalay at the weekend, providing at least training for about 100 of them on how to provide psychological first aid, to provide some initial relief to people who are deeply traumatized. But then, of course, what is required is the long-term mental health programs that need to be developed. And I think that's also something that will be important for us, but also for other organizations to take on board. And I think what we can see at the moment is there's definitely an effort within local communities where people are volunteering, they're stepping up, but they need the support from experts who know how to run these programs in the wake of a disaster.
Borrie, you at Médecins Sans Frontières, or I should say Doctors Without Borders, have warned of a long and intense emergency, and your efforts will now be in secondary healthcare. Can you explain why, in the context of what's been happening to the, I guess, healthcare system in Myanmar, and also, what makes this particular, if you like, crisis specific in terms of its needs?
Yeah, what's clear to us, at least from having worked in Myanmar for since 1992, as I've mentioned, is that there's limits to what the healthcare system was able to do prior. And there's also instances in the past where an ongoing conflict disrupts the ability of communities to safely seek healthcare. So what we're seeing in the areas where our teams are currently present and responding is that the healthcare infrastructure needs to be rehabilitated quite extensively, and that's the one part. But people are also suffering in a very immediate sense of not having access to primary healthcare. So we've currently got at least one of our medical teams consisting of 2 doctors, a nurse, and a gynecologist. They're providing mobile clinic consultations in and around the Mandalay area. On their first day, they saw almost 30 patients within a short span of time. The kind of health needs range from pregnant women, people who've suffered not severe injuries, but injuries that over time will need some attention. So cleaning those injuries, those wounds, will be important to avoid infection. And so those are basic sort of primary healthcare services that need to be reestablished. And so that's what our immediate focus is now. And then importantly, also, we can't run hospitals without stable electricity supply, without clean water supply. So those infrastructure challenges are very real. You mentioned earlier some of those challenges related to the rainy season, but also transport infrastructure has been severely affected. So getting supplies to the right place at the right time is an abiding challenge that we're still working on resolving ourselves. And also others, the Ministry of Health will specifically also face those exact challenges. In Naypyidaw, the capital, we're also doing assessments in the capital to try and see what activities we can undertake, what rehabilitation work could do on some of the hospital and healthcare infrastructure there. We know at least of a 1,000-bed hospital that's suffered significant damage, and so we need to look at alternative ways of sustaining basic healthcare, primary level care, but also secondary level care, and then also having capacity to provide surgical care if it's needed in a context like that. So yeah, I think in short, we're in it for the long haul, and this is a disaster that will have significant consequences into the weeks and months going forward, if not years.
Okay, Borrie, I appreciate your time. Thank you so much for talking to us. We'll have to leave it there. Borrie Lagrange, Regional Director of Communications, Doctors Without Borders.